the next time you need medical care, don't be surprised if you don't recognize your doctor. There's a new trend in healthcare providers. They're called hospitalists. So what exactly do they mean to you, the patient? Anita Vogel is live in our West Coast newsroom. All right, Anita, so first of all, what the heck is a hospitalist?
Well, hi there, Megan. Well, it's a doctor that appeared in the hospital about 10 years ago. It's become a lot more popular since then. These are full-fledged physicians who concentrate on medical care in the hospital. They take care of patients in the hospital. Again, they are full-fledged doctors who can treat most ailments, and then they also can go on to become a case manager if the patient needs to be seen by a specialist.
A patient who may come to the emergency room for chest pain. And so the hospitalist, again, will see the patient in the emergency room, coordinate the care with the primary care physician, and start, asking appropriate questions. Did the patient have an EKG before? Does the patient have risk factors for heart disease? And what they'll do is they'll gather the information and use that information to better begin the treatment of the patient.
And in fact, hospitalists are one of the most rapidly growing medical specialties in the country. There are now 30,000 of them practicing across the country, Megan.
So we're hearing now that these hospitalists are going to be very popular under the new health care legislation. What do you know?
Right. Well, one of the things hospitalists can do is to really help hospitals cut down on their costs because they're watching these patients from the moment they get into the hospital till they exit. So they can help cut down on costs by making sure tests and medicines are not duplicated. Also, that patients get treated essentially better and faster and perhaps even released earlier. Under the new healthcare legislation, hospitals will be penalized for readmissions and medical errors. So hospitalists can play a role in helping things run more smoothly. Now, if there is a downside for patients, perhaps when they're at their most vulnerable in the hospital, they'd like to see their own familiar family physician. But, those family physicians can't visit that often, only in the morning and at night. So hospitalists can be there 24 hours a day. Megan.
All right, Anita Vogel, thank you.
The number of them has mushroomed in hospitals over the last decade. They call them hospitalists, doctors who focus on round-the-clock care, following patients from admission to release straight through. Hospital officials say these doctors can more quickly tend to a patient's needs and also help cut hospital costs. But some patients say these hospitalists are like strangers who show up at their bedsides, and they'd really prefer their primary care physicians. Anita Vogel is live in our West Coast News Hub this afternoon. Anita, what are the details here?
Well, hi there, Shepard. They started appearing in hospitals about a decade ago, and now there are nearly 30,000 of them practicing across the country. They are called hospitalists, and they are stepping in for the family physician when patients need them the most.
75-year-old Henry Clancy was brought to Providence St. Joseph Medical Center because he needed a specialist to treat an infection related to his pacemaker. For nearly 2 weeks, he's been under the care of a hospitalist, an MD whose primary focus is overseeing care while patients are in the hospital.
I treat patients with pneumonia, with heart attacks or chest pain, emphysema, kidney stones, anything from serious to not so serious. Doing well.
Dr. Gilbert Esai was Henry Clancy's primary physician during his stay, but also coordinated treatment from a series of specialists. Officials say case management cuts down on skyrocketing costs.
When you have a physician dedicated to the care of the patients in the hospital, there's less chance of error because, again, laboratories, tests, and patients are examined and re-examined sometimes several times a day, so there's less that could basically fall through the cracks.
Hospitalists also keep in close touch with the patient's doctor. A consistent presence, Henry says, helped him breathe easier.
I think he'll follow up on me real good. He seems like he cares. It's not just his job, but I think he cares.
And studies show monitoring by a hospitalist can save healthcare providers up to 20%, but they're not perfect. Studies show they also make mistakes, sometimes failing to pass along pertinent information to the family doctor. And what patient wouldn't rather have the family doctor standing by their bedside in a perfect world? Shep, back to you.
Anita Vogel live this afternoon in Los Angeles. Anita, thank you.